Heard It Health is sponsored video content brought to you by MedCity News.
Hello, welcome to Heard It Health. I'm Katie Adams, a reporter with MedCity News, and I'm here with Malakeh Amini, the CEO of Trayt, which is a data collection and analytics company that's seeking to improve brain and behavioral health. So, your technology promises to increase access for people who have behavioral health conditions. Could you tell me more how your solutions do that?
Yes, so our mission is to increase equitable access to care for behavioral health patients. We have partnered mostly with statewide psychiatry access programs that are funded either by the state or by federal agencies in order to deliver services through collaborative care. So we are connecting primary care physicians into psychiatry clinics, schools into psychiatry clinics, and even opioid and substance use clinics in order for them to have either consultation services or to have direct intervention for patients that are showing signs of behavioral health symptoms but otherwise would not have access to care. We're primarily serving the population that is marginalized or is in what we call behavioral health deserts, where access to any resources is unavailable, and they typically use ER or urgent care for their needs. We actually enable the virtual care, the telemedicine visits, and also the data collection that enables all of the clinicians to share information and provide a coordinated care to patients.
From what I know about you, you seem so passionate about this type of access because you've been through some of these frustrations yourself as a parent. Being directed to multiple different providers for multiple different symptoms. Could you talk about how frustrating that is and how your company's trying to address that issue?
Yes, so behavioral health in general and all neuropsychiatric disorders are complex disorders. This is something that we really talk about, but it doesn't really become part of a clinical care. They always have accompanying and co-occurring conditions. They always need multiple providers to assess and treat patients. And standard of care today puts all of that burden of coordinating and sharing information on the families. And that is an extremely challenging path to take because a parent doesn't know how to navigate this, who to call, what to do. Even I myself have at times used ER to get some of the answers. So what is needed is a patient-centered platform that not only adds those complexities into a single platform, but also creates coordinated care. So what we have built is a platform that has secure access into the single unified data platform with centralized consents. And there is clear coordination across all providers and even caregivers or other types of observers in order to not only have the comprehensive data, but to coordinate the care. Multiple providers are trying to treat the same symptoms. Mm-hmm. A patient with depression is going to have a psychiatrist for medications, a therapist for the type of counseling they need, a school counselor if the patient is school-age kid, and then the parents, right? So all of these different observers have something to say and observe something about the patient. So including all of that information and making sure that as we're trying to treat the same exact symptoms, that we all are coordinated and delivering the same consistent care to them.
Thank you for that explanation, really understanding all the different inefficiencies for everyone involved. So I know that Trayt Health is also very serious about trying to understand the drivers behind behavioral health symptoms. So can you talk about some of the key aspects that are involved with assessing patients and how it really drives the treatment decisions that behavioral health providers make?
Yeah, of course. So there are, and this is known, for example, social determinants of health are considered a non-medical driver of healthcare, and it does have some predictability on health outcomes improvement. Trayt actually looks at a granular level of data, both in terms of connecting brain symptoms to medical symptoms, and then including those non-medical drivers at a granular level. So looking and understanding a patient's environment, a patient's cultural background, a patient's general home environment. All of those are drivers of behavioral health symptoms. We, in fact, at Trayt call it the social determinants of mental health. And so creating that level of granularity for non-medical drivers and including them in day-to-day care is an incredibly important factor in a clinician assessing and diagnosing a patient and understanding what type of treatment that patient needs. An example is 2 patients that have bipolar disorders. In bipolar disorders, some of the real impulsive behaviors are not in the control of the patient. And then 2 patients with the same condition receive the same medication. One patient improves, another one doesn't. A patient, let's say 2 kids that have bipolar disorder, one of them has parents that continuously punish the kid for those impulsive behaviors. That is only going to drive more of those behaviors, more depression, more anxiety for that patient. So even though the patient is receiving the right medication, there are other types of therapies such as family therapy, educating the parents, providing at-home services that are combined with medications. And unless the clinician has access to that data and unless it becomes part of day-to-day clinical care, there is no other way of understanding it. What Trayt has done is it has included over 750 different symptoms and environmental factors that could impact a patient's behavioral health symptoms and synthesizes and analyzes that information in a way that provides clinicians not just with the tools but the data that they need to make those more informed decisions about a patient.
750 factors, wow, that's really interesting. Thank you for going through that. And thank you so much for your time today. I hope you enjoy the rest of the conference.
Thank you for having me. It was great to talk to you.